Hello, and welcome to AHS Health Matters. I'm your host, Kelly Morris. Joining me today are health experts from our community telling us advice on how to live a healthy lifestyle. First up today is dietitian Ashley Bray. Hi, Ashley.
Hello.
So tell me about the Feeding Infants video series.
Yeah, so it's a series of 10 videos on a variety of topics. We know that parents have a lot of questions when they're introducing solids, so we've included information on breastfeeding and formula feeding, how to know when your baby is ready for solids, what to offer, and even some tips on making baby food. We also have information on different textures, including baby-led weaning, and finally, we cover how you can help prevent food allergies and the feeding relationship. The videos contain the information that parents need, but we've also linked to further reading for people who want a little bit more detailed information.
So why did you develop these short videos?
Yeah, we've been hearing from parents that sometimes it's hard to attend a 2-hour class with a new baby, and people often find it more convenient to find information online. So we wanted to make an option that parents could view at any time, and that they could also pick and choose between the topics depending where their needs or interests might lie. The videos can be used as a refresher for people who maybe attended a nutrition class when baby was younger, or maybe for a second-time parent who's looking for an update on best practices.
What other supports are available for parents who are looking for information about feeding their babies?
Yeah, so the videos are only one way that you can find the information, and you can find that link at bit.ly/feedingbabiesvideos. But you can also take an infant class. We offer classes through the Baby Steps program offered through Public Health, and that's in Lethbridge and Medicine Hat. But we also have some online options, so you can take a facilitated online class, or we also have recorded options. Information on how to access all of these options can be found at bit.ly/nutritionclassinfo. You can always access nutrition information on our website, so healthyparentshealthychildren.ca, or Healthy Eating Starts Here. And if you feel like you need more support, we also have dietitian services. So parents can always call one of us, one of the public health dietitians at their local health unit, or they can email us at publichealthnutrition.southzone@ahs.ca. Or they can book a one-on-one appointment, and they can find information about how to book that appointment at ahs.ca/nutrition.
That's awesome. I know I have 2 young kids myself, and even in the 3 years between when they were each born, things change, and those refresher videos would be really helpful. So thank you so much for introducing those to us today. You gave us a lot of links as well, so we'll put those URLs up on the screen for you. Thank you so much, Ashley, for being here with us today. We'll be right back with our next guest. Hello, and welcome back to AHS Health Matters. Joining me now is Brandy Brown, a health promotion facilitator with Alberta Health Services. Coming up on July 5th, it is National Injury Prevention Day. Now tell me, what is National Injury Prevention Day?
Well, National Injury Prevention Day is just a day to raise awareness on injury prevention and to aid Canadians in living long, happy, healthy lives through education and advocacy. As you mentioned, it is coming up on July 5th, and it's actually the 7th year the campaign has run nationally. So throughout your communities, you might see a little bit of extra green on that day. So Lethbridge City Hall will be lit up green to raise awareness. Over in Medicine Hat, the public library and the Samus Teepee will also be lit up. And throughout a variety of healthcare centers, staff will be also donning green and doing their own initiatives within their facilities.
Why is it important to raise awareness about injury prevention?
So injury prevention is just one small piece of the healthcare puzzle, but it is critical in saving lives for Canadians, and it's a shared responsibility for us all. Injury is currently one of the leading causes of death for Canadians ages 1 to 44 and costs our economy upwards of $29 billion per year. We know many of these injuries are predictable and preventable, but we just need to collectively come together to help raise awareness and minimize injuries within our community. Many probably think of the physical pain initially associated with an injury, but we do need to kind of look long-term as well. We might start to see a drop in family income if a provider is unable to work due to injury. There is also the rehabilitation process, additional support and dependence on friends, family, social services, and healthcare services across in the community as well. And then there is that little bit of parental guilt that might follow the injury of a child, and then just kind of the general change in our own lifestyle in our family.
So, what type of injuries are we talking about specifically here?
So there are quite a few injuries that would fall under this umbrella, but 75% of preventable injuries come from falls, motor vehicle collisions, and poisonings within the home. Every day we see about 48 Canadians and 48 Canadians die and 634 Canadians hospitalized. Here in Alberta, we see about 6 deaths per day related to injury. So a fairly substantial number to consider, yeah. When it comes to poisoning, last year Poison Control reported that 60% of calls into their center were from children who consumed medication or any household toxins or poisonings. So really big number that contributes to an unintentional injury for our children.
Some examples I hadn't even thought of as being considered an injury. So, what are some tips or advice that we can take into our own lives to prevent injuries?
Good question. So, generally we all we know that injuries happen and bumps and bruises are a part of life. But it is really just important, whether you're at work, at home, or at play, to kind of just take a second glance and a second thought about what you could do to prevent injuries for yourself. So a few quick examples might be just taking personal responsibility for whatever activity you're participating in. So that might mean making sure you're wearing a helmet or buttoning up and zipping up that life jacket if you're out in the water. Second, you might want to be able to share your own knowledge and experience with friends, family, and the community. Making sure that you have the opportunity and are getting trained in the activity that you're going to be partaking in. So for some, that might be enrolling in swimming lessons, doing driver's training, taking a CPR or first aid course. You might also want to enroll your kids in a babysitting or home alone course just to give them a little bit of extra confidence for being at home. Then if you take risks, just make sure they're calculated risks. So again, making sure you're wearing the right equipment for the right activity. So again, wearing helmets, life jackets, things like that. If you are heading out, making sure that you're checking the road and weather conditions or the use of the trails. Really important. It's something we do quite often in the winter time, but we might not think to do that in the summer, just to be well prepared. And then finally, just managing your environment and decreasing your own hazards. So again, checking those road and weather conditions, making sure that whatever equipment you're using is in good working order. So tuning up your bike at the beginning of the season. If you're out on an ATV or an OHV, making sure everybody's got helmets and appropriate gear and those machines are working properly as well. And then finally, just considering the consequences of our own actions. So when we're behind the wheel, making sure that we're following speed limits, driving sober, and putting down those cell phones and avoiding any distractions while driving. And generally, we just need to promote a culture of safety within our communities. And I challenge everybody this summer when they're out being active, just to take a second look at what they're doing and see if there's any way they can minimize injury in their life.
Excellent. That's a lot of great tips to keep us all safe this summer. You pointed out a lot of things that I hadn't even thought about, so thanks for those reminders today. Is there anywhere else that we can find more information on how to stay safe or on Injury Prevention Day itself?
Yeah, so if you're looking for some more information, you can visit www.ahs.ca. Or you can also visit www.parachute.com, and they have a wide variety of information focused on injury prevention in our communities.
Wonderful. Thank you so much for sharing all of that with us today. Lots of great advice to keep us safe this summer. We'll be right back on AHS Health Matters. Welcome back to AHS Health Matters. Joining me now is Chloe Trautman, a health promotion facilitator with Alberta Health Services. And on this beautiful sunny day, we are talking about sun safety. So Chloe, how does the sun affect you?
Yeah, so from patios to ball games to picking up your dry cleaning, most of us spend a lot of time outside in the sun throughout the nice summer months. But we need to protect ourselves and our family, not just while we're on vacation, but while we're at home, and not just in the summertime, but in the winter months as well. And even some Albertans have to work outside, so their exposure to the sun is higher than those of us who don't work outside during the day. But the fact is that UVR, ultraviolet radiation, from both the sun and indoor tanning is linked to not only skin cancers, but a whole spectrum of health risks, including eye damage, a weakened immune system, and an increased risk of recurrent skin cancer. So it's really important that we protect ourselves from the sun.
Absolutely. And why is sun and sun damage an issue?
So exposure to the sun and other sources of UVR, without sufficient protection, is known to cause harm to our skin and our eyes. So generally, the increased time in the sun without improving protective factors, our melanoma rates are increasing, and about 65% of our melanoma cases, which is the most fatal form of skin cancer, is associated with solar and artificial ultraviolet radiation exposure. And this is a modifiable risk factor, so things that we can do to prevent in the first place.
So I feel like over time we're learning that the sun's maybe not that great for us, but I feel like there's maybe still some myths or rumors out there. Can you tell us about some of those myths and what the truth really is?
Yeah, absolutely. So the biggest one that I hear a lot still is that skin cancer isn't a big issue, but the fact is that skin cancer is the most common cancer in Alberta alone. Another myth is that a tan is nature's way of making the skin more resistant to UVR exposure, but in fact a tan is only equal to a sunscreen with an SPF of 2 to 4, so it's not sufficient to provide adequate protection from sunburn or skin cancer. Another one is you don't need to wear sunscreen or pay attention to the UV index on a cloudy day. That is false. The fact is that UV index can still be high on cloudy or partly cloudy days. So clouds only block 20% of the sun's UVR, even though they block the visible light. Another myth is that the temperature is a good way to tell what the UV index is, but the fact is that the UV index reflects solar UVR intensity, which is not related to temperature. So factors like latitude, altitude, air pollutants, cloud, reflective surfaces, time of year, and time of day determine the UV levels.
So this is a topic that's close to home for me because I have some fair-skinned, red-headed children. So we are definitely familiar with sunscreen. But what are some other things that Albertans can do to protect themselves and my red-headed children from the sun this summer?
Yes, I hear you on that with the fair skin, me as well. So these are hitting home for me too. So whenever possible, plan your outdoor activities before 11 a.m. and after 3 p.m. when the sun's rays are less intense. Using sources of vitamin D that are safer than UVR exposure, so things like your diet, that could include fortified foods like breakfast cereals, snack bars, milk and plant-based alternatives, and vitamin D supplements. Intentional UVR exposure to meet vitamin D requirements is not recommended. When you're checking the daily weather forecast, make sure that you check the UV index by Environment Canada. So if a UV index is about a 1 to a 2, that's very low. If the UV index is about 6 to 7, that is high, and anything higher than an 11 is quite extreme. And then just making sure that you take breaks from the sun if you are outside, so taking those periodic shade breaks. So whether that be under a shaded tree, or you're providing shade or getting shade from a temporary structure like an umbrella, or by a building if it's providing shade as well. So just making sure that you take those breaks in the shade. And then sunscreen should be used on your exposed skin. So making sure that you lather up on any exposed skin, especially using sunscreen on your lips. That's really important, and something that sometimes people forget. So like a lip chap that has an SPF in it is really important. And then reapplying after strenuous activity, if you're swimming, sweating, those types of things, just make sure that you towel off and then reapply your sunscreen as well. So those are some ideas. And then of course wearing some eye protection for your eyes, wearing a wide brimmed hat or just a hat in general, providing a little bit of shade onto your face, and then making sure that you combine, comprehensive clothing with like if you have like a longer sleeved breathable shirt, and then wearing sunscreen on your exposed skin as well. So a few ideas, but those shade breaks definitely are key important, and sunscreen. So yeah.
Big shady tree.
Big shady tree. Yeah.
Excellent. Thank you so much for all of those great ideas. A few things I hadn't thought of before. Is there anywhere that we can find more information on this topic?
Yes, absolutely. So the Canadian Cancer Society has a lot of great information. They even go over how to make your own shade at home, planting your own shade, so like planting a tree or something like that. It has some sunscreen tips, some FAQs, facts about cancer, and as well Alberta's Healthier Together website is a great resource, and if you search in the bar sun safety, it has a lot of great information as well, and a lot of the things that I've talked about today.
Great. Thank you so much. And that wraps up another episode of AHS Health Matters. I'd like to thank Ashley, Chloe, and Brandy for joining us today and sharing all of these great tips on how to have a great and safe summer. Thanks for joining us. I'm Kelly Morris, and this is AHS Health Matters.